Hi, I'm Damien and I am the Trust Lead for Mental Health. And over the past few months, one of the things I've been doing is meeting with quite a lot of teams and individuals to reflect with them and focus on them about their experience of working through these very difficult times. And obviously COVID has really impacted on teams. We know that working in healthcare at the best of times can be a very stressful and personally demanding job, and these last few months have really just turned the volume up with regards to that. Staff coming into work in a strange environment with heightened concerns and risks around COVID, and of course others haven't been able to come in and have been isolated at home and working in remote ways. Many staff have come into work from a background of significant personal and domestic concerns, and so resilience is already very fragile. So this really is a time where personal kindness, understanding, empathy and compassion are essential to safeguard our own well-being and that of our colleagues. It's so important now more than ever that each of us takes opportunities to relate to each other with kindness. And whether you're a clinician, a manager, a member of the exec, domestic staff or corporate staff, we all need to encounter kindness and civility. We need to be regarded as people rather than roles and functions. And there's a lot of research about kindness. And the interesting thing about the research is the benefits to those who give kindness is as apparent as to those who receive it. Giving kindness stimulates serotonin, which creates a feel-good factor, quite like an antidepressant. It generates endorphins, which are the body's natural pain-killing methods. People who practice kindness are shown to have up to 25% less cortisol, the stressy hormone, in their systems. And kindness actually leads to an increase in oxytocin, which, as well as reducing blood pressure, also increases the love hormone. So there's a win-win situation there. And of course, folk who work in an environment and a culture of kindness just do better. There are benefits of emotional well-being, improved self-esteem, and really importantly, a greater sense of connectedness to the teams. And then of course people want to give more to their team and support each other because it's so meaningful to them. Based on my recent experiences, I think an area that needs to be looked at quite seriously is the nature of the line management relationship from both sides of that divide. And managers and clinicians will often have differing priorities. And sometimes if either group lose sight of this, then misunderstanding and divisions arise as folk assume that the other group don't care, don't understand, or don't value the other. And of course, both of us, both sides of that line, have an important contribution to make to the business of healthcare. And this really highlights how now, so importantly, we need to develop a culture which is compassionate, communicative, and kind. And needless to say, each of us have a really important role to play in this.